No.
I'd ask them.
Are you going to be okay? Some people do, some don't.
It is what it is now.
Well, no, you tell me. If it hurts, I'm deleting and we'll dub you. Some people it hurts and some it doesn't. I do it many times without it.
Alrighty.
So you'll tell me, but it is a lot of little baby pokes.
You're live.
All right, guys. So we are now going to do one of our very common treatments for sweating, which is Botox for hyperhidrosis. A lot of guys will sweat in their armpit area, the groin area, or the scalp. When I initially started this many years ago, I had a lot of marathon runner patients that would get chafing in their anal groin area when they would run long distances, and at that time we didn't know what really could help sweating. When we started doing Botox there, it was like life-changing for these spinners, for these marathon runners. Then it progressed into people using this for sweating all over the body. The issue is it's just expensive, so you have to, you know, fine-tune where you really want to do this. So for him, he's sweating in his armpit very frequently, especially if you're business professional and you're wearing clothes, you don't want the sweating to show through the clothes, or you just don't want to have the smell, or you just don't want to sweat. It will not affect swelling on the rest of your body, but it does require me to make a bunch of little injections. Now, in the old days, we used to do something called the iodine starch test, where we would paint this whole area with iodine, which is yellow, and then we put a powder on top, and that powder would turn purple where the person sweat a lot. The thing is, it takes forever to wash off, and it looks really bad. So we're going to concentrate in the central area. Anywhere there's hair is where there's follicles. Little pokes, okay? Not the best feeling in the world, but not the worst. And we just follow a little baby pattern. We just do little baby injections like this. Now this area, though, is sensitive, so you can numb. You could use ice packs. You could use Zimmer Cooler, whatever. But you want to be really superficial. We don't want to go deep. We usually do about 50 units a side. That's the standard. When we did less than that in clinical trials a long time ago, not a great result, or you didn't have longevity, meaning you would see the result, but it wouldn't last. So here we're doing that injection right now. It's perfect. We're about halfway done. I've done this numerous times without numbing, like my patient today, and it doesn't feel the best, but it's not literally the worst. We're also using, again, those baby Gucci needles just to make it more tolerable. We do an even amount. Most of the concentration of sweating is in the central area, so we try and put more in the central spot, and then we kind of taper it out as we go a little bit further. Each area will usually spread about 1 centimeter, so you kind of separate these about 1 centimeter or 2 apart. Typically I don't do the iodine starch tests anymore unless somebody really has aggressive amount of sweating, or we do the treatment and it just doesn't last a long time. Then we really need to concentrate where we do this. So we're going to go to the other side. Was that okay?
Mm-hmm.
Okay, not too bad. And again, we're going to do that same thing. Follow a little grid, little baby pinches. I try and keep it superficial, more concentrated in the center. It's not going to harm you to do more units if you really wanted to. It's just going to harm your wallet. That's the problem. And it's not my fault, it's Allergan's fault. You can go talk to them or the other makers of the other products, because they're expensive. They make you charge people a lot. But it's really great. I'll tell you, some people, this lasts way longer even than the cosmetic use of Botox. This can last sometimes 4 to 6 months. I have my best friend does this twice a year. He does his whole back. It's 1,000 units. And he does it twice a year, and it's like the life-changing for him. But, you know, just depends. So, little baby blebs, you can see I'm doing those all throughout. And a little bit more concentrated in that central area. He's doing really well. We thank him for showing you guys, because honestly, I think it's really important for people to know. A patient of mine yesterday is very famous, was saying for years she didn't really go to anyone because she didn't know who to trust. It's very hard to know who to trust anymore when it comes to your face and your body, but by seeing these videos and learning, you can feel a little more confident. And even if you can't come to me, you can know what questions to ask somebody around you.
I also find that when I tell my friends what I've gotten done, it makes them feel better about
doing the treatment
yeah. And saying, you know, who do you recommend?
Asking about it, because it's interesting, because nowadays, you're all done. Nowadays, more men want treatments. Mm-hmm. They're just nervous about where to go, mm-hmm. you know, and I will say it has mainly been women that have treated women. So women have a better view of what women typically want in general, but that doesn't mean that a woman can't know what a man wants either. It's just that how would you know? It's good to watch these videos. So that was Botox for hyperhidrosis, and we're now moving on to laser treatment. That was great. You okay?